Hi, this is Dr. Trudy Hall, Region 2 National Medical Association Chairperson, and we are here in Philadelphia at the Downtown Marriott, Region 2 Annual Conference, April 27th to 29th. And today we've had an amazing day of lectures, and I want to introduce you to one of our physicians that really kind of educated the group in such a different and fun way. We have Dr. Kindred, who is from our Onyx chapter in Columbia, Maryland. Dr. Kindred, so good to see you.
Thank you.
Great. Tell everybody a little bit about yourself, and then tell about what you just talked about, which is really fun and exciting.
Absolutely. So I'm a dermatologist practicing in Columbia, Maryland, and associate professor at Howard University. And I do a lot of community service, so we'll just wrap it up like that and cut it short. But today it was just a game, a really great educational game, but it was still fun. It was almost like a dermatology Jeopardy where we covered sunscreen, vitamin A or retinoids, hidradenitis suppurativa, and alopecia.
Great. So I learned a lot. So there was a couple things that I think is really important to just talk about, black skin and the myths. So what do you think is, and you brought up some of them in your lecture today, but what do you think is what's the top 3 or 4 myths that you really talk to the doctors about, but also to talk to the community about?
Yes, so one is sunscreen. And the myth is that sunscreen protects blacks against skin cancer, where generally our skin cancers are not in sun-exposed areas. So for blacks, sunscreen is important for anti-aging, wrinkles, sagging, laxity, and more importantly, discoloration. We actually age more with discoloration than wrinkles. The second myth that we covered was for hair loss, and that is biotin does not regrow hair once you have hair loss. That was a good one.
Yeah, that was a good one.
Like I said, I need biotin to just die because that myth won't go away.
But I think what you brought up is that biotin also can be harmful.
That's the piece. So biotin can really mess up lab results. So when biotin's in your system, it can hide a disease you have or make you look like you have a disease you don't have, in which case that'll send us as physicians barking up the wrong tree, which has been found to be deadly in cardiac cases. There was one more myth, for hidradenitis suppurativa, which is just where black women get recurrent boils in their underarms, groin, etc. And that is for patients to not run straight to the ER and get them lanced. I know it takes a long time to see a dermatologist, but it's so worth it.
Yeah. I do want to talk about sunscreen. So you brought up a point. You also get harmful rays from blue rays from your computer. Talk about that, because we were in a pandemic and everybody's doing virtual committee. People are working from home,
yes,
and they think they don't have to apply sunscreen. So
right.
Tell us a little bit about that, and then how much SPF is necessary.
Okay, so first the blue light and then SPF. Blue light, we're referring to the blue light from tablets, computers, cell phone, and they age our skin. It seems to be a bit more detrimental in black skin than say white skin. Still, we don't think about all the sources. So those are the sources of blue light. Don't forget sunlight from the window or driving in a car. SPF, generally SPF 30 or higher is sufficient for your moisturizing sunscreen.
So I know that some of us don't like that cakey, thick kind of feel of our skin, especially if you're going to wear it underneath makeup. So, what are some options for, you need to put it on every morning, but you still don't want to have, your skin look funny because it's really thick and
right.
Especially for black skin.
Looking like the Tin Man from the Wizard of Oz.
With the cakiness. So
yes.
Some options.
So finally, they're actually paying attention to this. One company is Isdin, ISDIN. They make a sunscreen that looks good on our skin. The other is CeraVe AM, and then La Roche-Posay Anti-Helios. Those are some over-the-counter ones that are really affordable that one could buy and have a good outcome, have a nice, elegant finish to it.
Excellent, excellent, excellent. So we're going to wrap up. What do you think is the final myth you want to debunk? And also, I think a little bit about hair loss.
I was gonna bring
Hair
that
loss,
up
because I am going to confess a little bit personally. My hairdresser said, you're losing hair. I mean, it's nice, it's less time to blow dry my hair, but I'm getting through that phase where I'm having postmenopausal hair loss. But tell us about hair loss, and also I want to talk just 1 second about some of the hairstyles and patterns that what I'm finding younger and younger blacks are doing, and how it impacts their hair follicles. I'm talking about wigs, I'm talking about weaves, I'm talking about tight braids. So talk a little bit about hair loss, and then just really talk about the caution regarding some of those hairstyles.
So I think I'll answer that by just going over the top 3 types of hair loss that I see in blacks in my practice. So the number 1 is CCCA, central, centrifugal, cicatricial alopecia. So it typically starts at the center of the scalp. And the most important thing I can say is the way to check if you're suffering from hair loss is just part your hair down the center. And if you see the part starting to whiten, then you may want to see your dermatologist. So CCCA has symptoms. Sometimes people have no symptoms, unfortunately. But the good news about the symptoms, it tells you there's something wrong. Itching, burning, tenderness, soreness, outright pain. When there's no dandruff, no wound, no reason to have those symptoms. So CCCA, you really have to go to a dermatologist that knows or that specializes in hair. Then the next one is hormonal, female pattern or male pattern hair loss. The number 1 form of hair loss in the world, which typically around 50s or 60s, but there's some in their 20s that get it at that time too. And then what you alluded to, which is really unhealthy hairstyles that can lead to traction alopecia. And traction alopecia is not just from tight braids, as you mentioned, or tight ponytails, but also when we have our hair going in the same direction. So I like that the young people now, I guess how you and I did back in the day, they have the baby hair out, so it's not being pulled in. Oh my God,
the baby hairs.
Yes.
Yes.
Except some of them are now doing that too tight with some of the edge control, and it's pulling out those edges.
Wow.
Yeah, so we just have to stop, as a culture, stop being so obsessed with neat edges. And as I mentioned, I'm the first dermatologist with a full-service hair salon in-house. So I have a stylist in the office, Susan Peterkin, and we're able to train patients how to still have a hairstyle that they like, but that's healthy.
Excellent, excellent, excellent. So how can someone get to see you? What's the best way?
Good luck. But. So no, kindredhairandskin.com or 443 Hair Skin on Instagram. The handle is Kindrederm, KINDREDERM.
Great. So that's Dr. Kindred here at our Region 2 annual meeting in Philadelphia. #NMA2 Philly Takeover. Thank you very much.